Hi, everybody, and welcome. From our chat, it looks like we have a fun group of folks with us today. So my name is Heidi O'Neill. I'm with JBS International, and good afternoon. And to those of you in Hawaii, as we've already figured out, good morning. Thank you for joining us today for our webinar, Introduction to State TA. Before we begin, I would like to review a few housekeeping items. As you come in, go ahead and put your name and the state that you're from in the chat, and you will find the chat feature located at the bottom center of your Zoom window. Due to the high number of participants on this call, all participant lines will be muted for the duration of the webinar. If you have any comments or questions, please submit them at any time using the QA feature. To open your QA window, please click on the QA icon located at the bottom center of your Zoom window. As another point of note, we are pleased to have AI Media present to provide live captioning services for our webinar today. To view captions, you're going to click the Captions button located at the bottom of your Zoom window. If you don't see a Captions button, you may need to click the More button and choose Captions from that menu. From there, you can choose captions settings where you'll be able to adjust the size of your captions. You can also click the link provided by AI Media that will be located in the chat, and that will allow you to view the full transcript in a separate reading window. It'll open in your browser. If you experience any technical issues during this webinar, please message us using the chat feature, or you can also email us at samhsstateta@JBS International, and that email address will also be added to chat. Lastly, this is a recorded event, and your participation grants your consent to be recorded. The recorded webinar and PowerPoint slides will be available and sent to participants at a later date. So now I'm going to introduce everyone to our presenters. Today's presenters are Doug Slothauber, SAMHSA Section Chief, Angie Jones from JBS International, Tim Tunner from NASHBID, Ellen Radis from AHP, Dr. Jessica Pollard from NASHBID, Dr. Tamara Daly from APT, Michelle Cleary from AHP, Ted Lutterman from NRI, and Megan Haupt from NASHBID. Now we're going to move to our disclaimer slide. So the views, options, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. And without further ado, I'm going to turn it over to Doug.
Thanks, Heidi. Next slide, please. So the purpose of this project is to support SAMHSA's mission by providing technical assistance to recipients of the Substance Abuse Prevention, Treatment, and Recovery Services Block Grant and the Community Mental Health Services Block Grant, emphasizing the effective use of block grant and set-aside funds through implementation of innovative and evidence-based practices and models. Some of you may remember that CMHS had a similar contract providing TA that ended in 2018. We've heard since then that states have missed that support. As we all know, there have been several significant mental health block grant supplements and appropriation increases in recent years, and CMHS has made the decision to revive this contract as part of our ongoing partnership with states and territories. Next slide. The State TA project supports SAMHSA's mission and strategic initiatives by assisting in technical assistance around the planning, design, and implementation phases, all of which will be discussed in later slides. Next slide. This project serves 50 states as well as territories. Next slide. And this project is jointly funded by the Center for Mental Health Services and by CSAT. And with that said, I will hand it over to Angie.
Hey, thank you so much, Doug. JBS has partnered with lots of wonderful organizations to do the State TA project, and we are so pleased to all be working together, as Doug mentioned, on this project that is a great resource for states. So JBS is working alongside APT Associates, the Advocates for Human Potential, NASHBD, or the National Association of State Mental Health Program Directors, NRI, or NASHBD Research Institute, NASADAD, the National Association of State Alcohol and Drug Abuse Directors, National Disability Rights Network, and SMHAs. Some of these entities are working more on the substance use side, and some are working more on the mental health side. And SMHAs is our partner who's working more on IT areas. Next slide. So the objectives of this project are to improve the effectiveness and efficiency of use of block grant funds by states and territories, including the implementation of block grant set-asides, to improve the adoption and use of promising, best, and evidence-based practices, to improve mechanisms for collective and peer-to-peer TA among states and territories, including learning collaboratives and other communities of practice, and to improve effective responses to issues identified for individual states and territories, as well as broader trends among them by compliance and evaluation activities. We have lots of different mechanisms for being able to provide these services. So there's, as others will discuss later on, we have on-site and off-site TA services that are available to states to really meet your needs. We have a lot of different technical assistance around evidence-based practices. We also are doing some learning collaboratives, which we'll hear about later. We have some activities around state TA planning. So we're super excited about these activities. Next slide. So the approaches, first of all, we're going to work in every case to identify experts that you can work with at your state that meet your needs. So this is not a one-size-fits-all approach. This is an approach of meeting states' needs and connecting the right expert with you. And so that will be our first step in any technical assistance activity that we undertake with your state. Then we'll provide TA training and consultation to states and territories. And finally, we're going to disseminate and support the adoption of promising, best, and evidence-based practices. Next slide. I'm now turning it over to Tim Tunner with NASHBD, and he's going to discuss some of the services available through this project.
Right. Thanks, Angie. And as Doug mentioned, really the major purpose of this project is to help states and territories with receiving training and technical assistance. And some other folks on the call will talk about some of the specific, mechanisms in this project. But one major part is that this provides an opportunity for really much more open-ended technical assistance. So whereas some of the TA centers out there, they tend to focus on one topic or one population, really this gives an opportunity for states to request TA on whatever it is that they have needs within, in terms of mental health and addiction services. The only exception to that is because this is funded through the mental health block grant, it cannot be used for hospital operations. However, if it's used for competency restoration or assistance with discharge planning or community reentry, there are some opportunities to be able to receive support with those initiatives in your state or territory. It's also worth noting that each state and territory is not limited to just one request. So if you have more than one project that sounds like a really good project in the state, then you don't have to choose between them and say, I don't want to do this one now because I might need this one later. So if you have more than one good project, then you're welcome to make requests for them. Also, once a TA has been approved by SAMHSA, then we will cover all of the expenses for the consultants. So you don't have to worry about procurement. You don't have to worry about contracting. You don't have to worry about any of that. SAMHSA wants to make it as easy as possible for you. So we'll take care of all those logistics, the travel, the consultants, hotels, their airfare, all of that. We'll cover all of that. And you just make use of their time, so that, hopefully the consultants can really help you to make some differences in your state or territory. You can make a request for a specific consultant if you want. So if there's someone you have in mind that you think this is someone that we'd like to bring to our state to help us with such and such project, you're welcome to make a specific request. But if you don't know a specific consultant, then you can just make the request and we will find a consultant for you. So really it's up to you. It's important that the commissioner or director of the state mental health system in each state and territory, they will need to give approval of any project that is requested. So what happens is once a request is submitted, the request goes into, you submit the form, it goes to SAMHSA, but before that it has to go, an email will get sent to your commissioner or director to say, yes, I know about this, and yes, I approve of this. So SAMHSA wants to make sure, understandably, that the commissioner or director knows what's happening in their state and approves of it. So there is an email address that you would send and make a request. So you send it, and it's at the end of this email. Of the end of this presentation, and we'll also put it into the chat here. So you send an email to that address. It's samhsastateTA@jbsinternational.com, and they will send you back the request form. And then you submit that, and then, as I said, the commissioner or director will approve it, and then it gets sent to SAMHSA, and then it goes through that approval process. And yes, that is exactly the in the chat, the SAMHSA State TA JBS International. It is for both the mental health or addictions. It's the same address. All right. Thank you. And I will pass it over to Ellen Radis.
I was talking in mute. Thank you. Thanks, Tim. Tim was talking about the TA that you can request. And here we're trying to give you some examples of the type of TA that we can provide. It's really a wide range, and we really want to be able to meet your needs. So we can provide you with TA around your service system, help with needs assessments, planning, operations. We can work with you in helping to implement some of the block grant set-asides for first episode psychosis or crisis and early intervention services. We can work with you around performance or outcome management, evaluations to help you better understand the impact of your programs. We can do work with you around workforce development, improving workforce culture, development of career pathways, recruitment, retention, using workforce data, as well as helping and providing some technical assistance around the financing of different services. So we really do have this wide range, and it's really up, you can be really creative in asking for TA that will help meet your specific needs. And now I'm going to hand this over to Angie again. I believe, did I get that right?
Thank you so much, Ellen. Yes. And I am wondering if AI Media will be willing to put the link in the chat one more time that links us to the transcript. Thank you. So I'm going to be talking just for a moment about comprehensive state TA plans. This is another opportunity, another activity that is part of this contract. So this is an opportunity for states to look at their systems and think through how to reach their ideal state system. And we can say this is an easy process, and it will provide you with a comprehensive planning tool to help guide states in thinking through their TA needs. And so we've done some hard work for you of trying to think through different elements that comprise a good mental health system, and thinking through what is involved in that. And so this TA would help you look at all those different elements and think through, is this, how do I make my system better? And what's necessary to get it to the level that I want it to be? And then we would help you design that plan and also help you get some technical assistance in place, some experts in place to help you get your system where you want it to go. All right. Next slide. We are also, I'm now turning it over to Dr. Jessica Pollard with Nashville to talk about set-asides.
Thank you, Angie. And I get to talk about one of my favorite topics, which is early intervention for first episode psychosis and early intervention for serious mental illness more broadly. So as we know, there is a 10% set aside for first episode psychosis and early serious mental illness, which has really supported the expansion of evidence-based and emerging programs for states across the country. And one of the first activities that we have developed to support states who are making use of these funds is an environmental scan. So really taking stock of what is the evidence base, what are the resources that are out there, and what other needs might there be from a technical assistance standpoint. So that's both for first episode psychosis as well as other serious mental illnesses that have a high disease burden index, so including mood disorders and anxiety disorders. Next slide. So along with an inventory of the evidence-based practices, what is all the work that's happened since our last environmental scan supporting the development of these evidence-based programs? So the environmental scan also describes all the activities that include the evaluation of the block grant set aside, the work of our PEPNAT colleagues, the Stanford Psychosis Risk and Early Psychosis Program Network, the EPINET or Early Psychosis Intervention Network, the Mental Health Technology Transfer Center, First Episode Work Group, and others. So there's really a comprehensive list of resources related to first episode and early serious mental illness. And so now that we have a good baseline for what's out there, as well as examples and information that you all have provided from a state leadership perspective about what additional technical assistance would be helpful, we'll next convene a virtual triage team of people who have expertise in early serious mental illness, as well as lived experience and family experience, so that we can develop a priority list or set of recommendations for what we should develop next for technical assistance materials, which we'll produce next year. Next slide. And to give you a sense of the types of products that we'll be developing for ESMI and FEP, these are the kinds of materials that and training resources that we'll develop. And this year, we'll be working on a broader set of topics outside of early serious mental illness and first episode. So to give a sense of what we're working on for issue briefs, expanding peer support services and supporting the peer workforce, co-occurring mental health and substance use disorder, person-centered planning, civil commitment, as well as best practices for establishing mental health block grant funding priorities. There'll be a set of brief reference documents for aging adults and financing. We'll be producing distance education courses on Block Grant 101 for mental health planners and supported employment, guidance manuals on the mental health block grant, as well as workforce, which I know is a high priority topic for everyone, a set of brochures on introduction to the state TA project. So this project we're talking about today, early serious mental illness and FEP, and then a few train the trainers, so supported education and supported employment, to make sure that states have resources for that infrastructure necessary for continued dissemination of those evidence-based models. And as mentioned, the topics that we identify in the virtual triage team will be implementing the work products or the technical assistance products next year. And now I'll hand it over to my AHP colleague, Ellen Radis. You're on mute, Ellen.
I do that all the time. My apologies. Another activity that we'll be working on is the development of behavioral health resources. And right now we're working on a resource that will be addressing the unique treatment challenges and working with the unhoused populations who happen to have serious mental illness. We're also planning on working on a resource around EMTALA And we'd love for you to put into the chat any ideas of behavioral health resources that you think might be useful to you as we continue to plan for the rest of this year and in coming years. So we, again, want to create resources that are going to be useful to you. So any ideas are welcome. Thanks. And I will hand this back to Angie, I believe.
Thank you so much, Helen. We're also, as part of resource development, going to be doing a couple more webinars during this year. One will be on emergency department boarding, an issue that's come up a lot as something that is important to states and that's a critical issue to talk about. We'll also be doing an overview of the 2024 mental health block grant application in consultation and coordination, of course, with our colleagues at SAMHSA. So those are things to look forward to. That will be a preview of changes in the block grant application that will hopefully be really helpful to states as they begin doing their new applications. I'm now turning it over to Dr. Tamara Daly.
Thanks, Angie. I'm going to share some information about our learning collaboratives. So these are a different type of TA since they're based on principles of peer learning. And the learning collaboratives are an opportunity for states to work closely with a small group of other states on a specific topic. The primary goal of the learning collaboratives is for states to share innovative practices and talk about how to address ongoing barriers. We'll also use information from the learning collaboratives to share information with other states that didn't have the opportunity to participate. So this year, we are offering 3 different learning collaboratives. Each collaborative will include 6 sessions over a 3 to 4 month period, and 8 states will participate per collaborative with 2 representatives per state. So this will be an intimate group of 16 participants per collaborative. Now, as I mentioned, the collaboratives will be interactive and peer-driven. Our first 2 collaboratives focus on the crisis continuum and workforce issues, and will begin the week of June 5th. There's a 3rd collaborative that will be used to support the mental health block grant planning councils in improving their operations. In the next 2 weeks, look for an email from JBS where you can indicate your interest in attending one or both of the learning collaboratives on crisis and workforce. And now I'm going to turn it over to Michelle Cleary.
Thank you so much, Dr. Daly. I'm going to talk a little bit about the resources that'll be available related to Olmsted inquiries and community integration. So what's currently underway is a report is being finalized that has compiled updates from the last 5 years on Department of Justice-led inquiries that resulted in lawsuits or other types of formal processes that relate to failure to comply with the Olmsted decision and or ADA guidelines for community integration of persons with serious mental illness. We will also be looking to you to help us update the community integration self-assessment tool. What we'd like to do is hear from you, from those of you who use the CISA tool, because we'd like your input on what's needed for updates. There's obviously many changes that have happened over the last several years, and we'd like to hear from you. So state planners, we're asking that you please keep a lookout for an email from our colleagues at NRI that will be asking if you would like to schedule a call to discuss. And then another resource that is being developed is a catalog of Olmsted technical assistance materials and resources. The resources are being compiled and will be available shortly on a website that is currently in development, but we will let you know as soon as that's available. And with that, I'll turn it back to my colleague, Ellen Radis.
Thanks, Michelle. The last thing that I'll be talking about today is the Planning Council Technical Assistance. These activities are designed to support the mental health block grant planning councils. And one of the activities that we're doing right now is we're updating the Planning Council 101 manual. So that is actually right in process right now. And hopefully that'll come out pretty soon. The other thing we're doing is we're planning 2 different listening sessions in April, and you should be getting notification of that hopefully this week, where we're going to ask planners and planning council chairs to participate. And this will be an opportunity for us to learn more about what your technical assistance needs are, what's going to be the best way to provide technical assistance to the planning councils, what kind of formats, and what are your high priority topics for TA. So be on the lookout for that invitation, and that'll be again in mid-April when we'll be doing these listening sessions. So thank you very much, and I'm going to hand this to Ted, I think.
Thank you, Ellen. Yep. So I'm going to talk about a series of tasks that NASHBID and the NASHBID Research Institute are working on related to crisis services. You all are probably aware that a year ago, Congress added to the mental health block grant a 5% set aside for crisis services. And SAMHSAs asked the JBS team us to work on a variety of activities to help support states' crisis service rollout and the use of the block grant. One of the first things that we've just completed is sort of a snapshot of behavioral health crisis services across the country and related technical assistance training needs. So SAMHSA had us go through every state's block grant application, your COVID supplement plans, your American Rescue Plan. And one of the things we searched for was any identified needs for training or technical assistance in those reports, and summarize those that can then help guide development of materials or future training TA resources. In addition, the overall report sort of highlighted issues that we've heard or could see from states in terms of implementing the entire crisis continuum. So call centers, both the Lifeline and other call centers or warm lines that states have, mobile crisis team implementation, are they statewide, issues in workforce funding, et cetera. The less than 24-hour crisis receiving stabilization facilities, discusses short-term crisis residential and respite programs, things like 911 and 988 coordination, sort of where states were at across each of those issues. And that's going to be helping guide future development. If you go to the next slide, the other thing that SAMHSA asked is for us to develop a way to sort of identify where states are at currently in their implementation of crisis systems for each state, a system that could be updated every year. And so they wanted to be able to have a baseline that described not just where we're at on 988, where there's a lot of information being collected, but to identify in each state, how many mobile crisis teams do they have? Are they statewide? Are they available 24/7? Who's running them? How many people they're served? What about the crisis stabilization programs, et cetera? So again, for that, we've been going through all the existing data sources that we could find, all the block grant materials and everything, put it into a standardized framework. Our staff is right now reviewing those to make sure we've captured all the information we can, and it's going to be going back to your commissioners and crisis coordinators. We expect next week. And what we're asking states to do is a quick review and make sure that it reflects your state's full crisis continuum the way you'd want SAMHSA and people that SAMHSA might share it with to see. And then the final report will go to SAMHSA. So it'll be a description for every state from Alabama through Wyoming, plus the territories. And then the expectation is each year we will be going back to update that, and hopefully SAMHSA can use that to demonstrate to Congress, funders, and others the progress states are making in rolling out a comprehensive crisis system. And with that, I'm going to turn it over to my colleague Megan, who's going to talk about some of the other work around crisis services we're doing to help states.
Thank you so much, Ted. It's great to work with you on this project. Did want everybody to know we are also having peer-to-peer learning sessions. Now, this is a little bit different than what you heard previously from Tamara. This is a series of 4 peer-to-peer learning sessions that are going to take place between now and August. They are larger. They are for state mental health commissioners and any people that they feel should be on this peer-to-peer learning related to mobile crisis teams. So the 4 peer-to-peer learning sessions, the first will address financing, the second will address workforce, the third will address children and adolescents, And the fourth will address rural and remote issues with mobile crisis teams. The very first peer-to-peer learning session has been scheduled for April 13th from 2 o'clock to 3 o'clock Eastern time. And that will discuss the use of Medicaid to help finance mobile crisis teams. CMS has been confirmed for presenting, along with a few states to share their experiences. So we hope to see you April 13th. We'll get further details out on that and as well as the subsequent sessions. So thank you. I'll turn this back to Angie.
Thank you so much, Megan. We did want to tell you that this there's also services available for substance use disorder. So many of you oversee both parts of the system. And so there is a similar scope of work going on the substance use disorder side, on the CSAT side. And we have a lot of the same sort of activities around providing on-site and off-site technical assistance. There is lots of resource development going on around different evidence-based practices. And so many of these same services are available on both the CSAT side and the CMHS side. And it is certainly our hope that you'll take advantage of these. Next slide. So for the most important piece of information, we want to tell you how to access these services. Right now, you can access the state TA project and any services associated with this project by emailing the SAMHSA state TA at jbsinternational.com email address. So if you desire on-site or off-site technical assistance, if you have a question about services, we check this email all the time. If you do want on-site or off-site technical assistance services, as Tim said, you're going to email us, we're going to send you a form, and then we're going to help it go through an approval process. So we'll route it to the right people. So anybody at your state can actually submit a request for TA, and we'll make sure it gets approved by a commissioner or the SSA before coming to us and then on to SAMHSA and the project officer. So we'll make sure that it gets approved in the way that it should and that you get the technical assistance you need. And we are really hopeful that you will submit these requests. There's lots of technical assistance available to you, and we hope, and SAMHSA hopes, that you'll take advantage of this great opportunity. I did want to say we are currently using something called Smartsheet. I saw a note in the question and answer, and I'm sure we'll address it more in a few minutes. But before the TA tracker is ready, it's not quite ready, we're using something called Smartsheet it's a web-based form where you can ask and request for technical assistance until the TA tracker is ready. So you would receive some emails from this automation at app.smartsheet.com. So don't be surprised if you saw that in your email inbox. Okay, we are now going to move on to the part of this presentation where we hear some questions and give some answers. So I'm going to turn it over to Heidi to manage this part of the process. So Heidi.
Sure. So the first question we have is from Trina Clark, and Trina asks, can we request TA for providers? For example, could we request TA for our crisis centers in meeting SAMHSA's best practices and third-party billing?
Thanks, Trina. This is actually an excellent question. That the important thing is that this TA should go to public mental health clients. So states are very different in terms of how how services are set up, whether the state actually provides services directly or whether the services are provided through a contractor and anywhere in between. So yes, you can request a TA for a specific provider, assuming that it does the ultimate services do go to the public mental health service clients. I don't know if anyone has anything else to add to that, or
Michelle or Doug, do you guys want to add?
Yeah, I would just add that the intent of this contract vehicle is to support states in the use of the block grant dollars. So the intent is really, ideally for the state to be sort of the locus of that expertise and then pass that on. But yeah, as Tim said, there are also opportunities if it is a state funded provider that can also be possible.
Okay, thank you, Doug. All right, this is from an anonymous attendee, and I think you've already addressed it, Angie. Well, let's see. It says, one of our POs told us that regardless of the instruction to request TA via the email address, they would not approve because JBS is developing a portal to request TA, that we must wait for the portal. Do not know how to address this barrier.
Yes, so we have, this is this other process. We do have an interim process until the TA tracker is fully through development. And so right now the interim process is through the email and then through this web-based form. And Doug and Michelle, shall I have anything else to add?
Well, I think we need to definitely let the POs know that the form is to be used. We've been communicating that with them. I'm not sure why someone would tell you to wait for the portal. That is not the case. Please use the email address in the form. We have actually already approved one TA to Hawaii. So Hawaii is getting both offsite and onsite TA. And they did it through this form. So please use the form.
Was information/invitations already sent to states related to the crisis system peer learning sessions that start in April?
The short answer is no. We will get that information out.
So the Learning Collaborative requires registration for the series. Once we have a staff register, can we change that slot to another person? If so, how would we notify you of that change?
I think that would not be our preference. We would prefer for it to stay with the same person, but I'm going to look to Michelle and Doug to respond as well.
Yeah, I would say that the best first step would be to reach out to the GPO and discuss, why that change is being requested and the circumstances behind it. And, we can just discuss that on a case-by-case basis.
Thank you, Doug. Okay, from an anonymous attendee. Can you please explain how this TA resource could support program evaluation? Is there funding to contract with a local university, or would one of the TA providers actually conduct an outcome evaluation?
So I'll jump in. So no, evaluation is not a component of this particular vehicle. You're certainly welcome to use, where appropriate, other funds for that, but this is intended to provide direct technical assistance.
Thank you, Doug. If we plan to request TA via the Comprehensive State TA Plan, which involves a comprehensive learning planning tool, would we not be allowed to submit TA requests, which we need more urgently?
Both would be fine. You could go ahead and request TA request and also go through a comprehensive state TA planning process. And again, I'm going to look to Doug and Michelle to make sure I stated that correctly.
Yes, that's right. They're two separate things. The TA planning process is to lay out sort of a long-term roadmap, and that doesn't preclude you from just using the direct request for immediate needs that you already know.
One of the first slides had a bullet point that indicated performance management, outcome measurement, and evaluation. Please clarify.
I think that's related back to the question around evaluation and if these funds could be used to hire an evaluator. And I think that TA could be used to talk through planning for evaluation and things like that, but it couldn't be used for an actual evaluator. But I'm going to turn it back over to Michelle and Doug to clarify more.
Yeah, that is correct. I mean, I'll have to go back and look at the slides really quickly, but that is correct.
Okay, someone's asking, do you provide TA for states that are planning to submit a combined mental health SABG application?
Absolutely. We would love to do that. And that's a major component actually of this contract. So yes.
Okay, another question says, what organizations can we fund with the TA funds?
So this again, this is the state TA project. It really is intended to support the mental health block grant. And so it's really the intended audience for this are the folks that administer the block grant. And so the mental health agency is really the intended recipient. And again, I'm going to go to Doug and Michelle to say more if they would like.
I would just add that SAMHSA does have numerous other technical assistance centers that are available around other specific topics and broad kind of mental health related topics that are more geared towards the provider level. So, you know, as Angie said, this particular vehicle is really geared towards the state level. And, you know, I would look to some of those other SAMHSA funded TA centers for some of those other local level provider needs.
Okay, so I don't see any, oh, here's one. In a previous slide, a webinar regarding updates to the mental health application was planned. Can you share any additional detail or time frame for this webinar?
Yes, it will either be, this is the one we've talked about being in July. It will be in July around the week of, I think it's July 17th through 22nd. We don't have a specific date, but the idea is the mental health block grant application will come out. States will have an opportunity to review the application, and then we'll do the webinar so that you'll have plenty of time to review it and ask questions during that webinar and get questions answered.
And I'll add, Angie, that if you want to see the 2024-2025 application, you can go to SAMHSA.gov. This is the application that has been submitted to OMB. It is not yet OMB approved. So we can't say this is what it's going to look like, but it'll give you a feel. How I get to it is I just go to SAMHSA.gov, and then in the search bar, I type in block grant, and then it pulls up the page for block grant. And then you can go ahead and look at the application there and get an idea of what the major changes were. It is still out for public comment, so that's why we can't finalize it yet. OMB has to approve it after the public comment periods.
Okay.
Wait, Kyle just said that SAMHSA took it down. Doug, are you aware that it was it taken down maybe to address the public comments?
I had not heard that update.
Me either.
Still open for public comment.
Hi, Michelle. This is Azeb. It was taken down after the public comment period ended.
Oh.
So it was taken down on the 27th.
When will it go back up? Do you know?
When we have OMB approval after the 30-day notice.
Oh, wow. And I didn't even save it.
See a few more questions coming, I think, into.
Yeah, it's about the, Angie, I'll tell you what, I'll see if I can't. I'm guessing because it's getting changed, we are making changes to it. I'm guessing that's why it was taken down, since that's not the version anymore. Okay. Let me see if I can get, more information on it, and I'll provide it to you. And maybe when we send out the slides, we can, sure. If we can get a copy of it, maybe we can send it out with that.
Absolutely. Absolutely.
Oh, thank you, Asha. It'll go back out in a week. Okay, everybody, there's Asha's answer.
Thank you, Asha. Yes. Okay. Let's see. So I see in a previous slide, a webinar regarding updates to the mental health block grant application was planned. We talked through that one. So this is the one. If the mental health block grant application webinar could be done earlier than July, please consider it. So I will put that out there. And then, will there be a reasonable time for the learning communities to participate given the different time zones? So the first learning communities will be in person. And so those will, happen in person. It'll be a full day event. The others, I don't think we have decided on specific times for the learning communities to occur. So that can certainly be a consideration as we're thinking through times for those.
Angie, there's one in the chat that says, when will you start the Learning Collaborative for mental health councils?
We have not decided on that yet. That is still in the planning stages. And that one will not have an in-person component. That's only going to be a virtual learning collaborative.
And one of the attendees said, just a note about the application webinar, our Planning Advisory Council will have already met for the final time before that July timeframe for the webinar. They meet every other month. So I think that was back to the question about, could it be done earlier than July? And that was the reason.
I mean, I can take it to leadership and see, but this was a leadership decision. They wanted states to have a chance to go in and look at it in BGAS and then have the webinar so that you could ask your questions. You also can go look at the application next week. Thank you, Asha, to get a feel for what the application is going to look like. And then you'll already, be ahead of the game if you look at the application before you start putting it in BGAS.
Okay, we are interested in general implementation training, specifically focused on supporting our program administrators and offering TA to our contracted providers and improving their support for the implementation of evidence-based programs, practices, and policies. Is this one of the TA offerings that might be available?
It sounds appropriate to my ear. Michelle's nodding. So yes, I think that would absolutely be something that's appropriate. And Michelle or Doug, feel free to weigh in more.
No, that's totally appropriate. Yep.
And you may see this, Michelle, that Arizona would second that vote for the plan requirements to be available earlier to provide more time to complete the application according to the requirements. So.
Right. I mean, I get it. I do. We had initially said end of June, but then we were corrected. So again, I'll take it back. Doug and I will take it back and see if we can hold it earlier.
Okay, and I don't think I've missed anything in the chat. Jamie, did I miss anything in the chat? I know she sent me a message saying I may have missed one.
No, I think you got it, Heidi. Great job.
Okay, great. All right. Does anyone else have anything they'd like to add to the Q&A section? We have 10 minutes left. Let's see. Do you happen to have cases to illustrate how intensive comprehensive TA planning would be? Resources.
So yeah, we are developing what we're calling a rubric. I'll just talk a little bit about the rubric. And the rubric looks at different areas and says, it defines what does a system that's kind of less developed to all the way more developed look like. And it lays it out. And so the idea is that you go through each of the areas and you say, where are we now and where do we want to be? And it shows you what you're aiming for. So a 4 is kind of the ideal system, and it has all the components of whatever area that is. So if it's a planning council, it would outline, you know, what would be an ideal planning council structure. That would be a 4. A 1 would be maybe a planning council is a meeting. And so it's showing you, and you look along the continuum and try to understand where you are and where you want to be. And that helps you understand what components you could add to your system to get to that next level. So I know that's not a actual reference document, but it does help you understand kind of how we're going to do that work with you all. And again, it will be a discussion and a really neat process to think through your current system and its capacities and, you know, what else is out there for you. I hope that helps.
Okay, I think that's all the questions. Let's see. Jamie, do you mind putting the state TA email address in the chat one more time so everybody can have that?
Heidi, I'll just circle back really quick. There,
Sure.
your question about evaluation. I did look back through the slides and I see where that's in there as an example of TA. And just to reiterate, that was you know, that's TA on sort of the uses of outcomes measurement evaluation, planning that out, building in a continuous quality improvement cycle, things like that, rather than funding the evaluation directly. Just to kind of circle back.
Thank you for clarifying that, Doug.
And I just wanted to add one more since we put the SAMHSA TA request email in there. This also came as a letter to your commissioners, and the planners were also copied, and it has all of this information in it as well. If somehow you lost the email and you can't find it, your PO should be able to direct you to it.
Okay, this is last call for questions. I don't see any more in the Q&A. I do not see any more in the chat. So that concludes our Q&A portion. As a reminder, the recorded webinar and PowerPoint slides will be available and sent to participants at a later date. We would like to thank you all again for your participation and all the fun you had at the beginning, and I hope you all learned a lot. And if you think of anything after we adjourn, please feel free to email us at the SAMHSA State TA at jbsinternational.com email address, and we'll be happy to get back to you ASAP. So everybody have a good day. Thank you.